Welcome to Menopause the Positive Way, the podcast that inclusively supports Women Plus moving through their menopause journey with greater ease, control, and an empowered mindset. You can subscribe to this series wherever you get your podcasts. Brought to you by Positive Health, making life easier and helping you make a change for the better. Hello, and thank you for joining us here on Menopause, the Positive Way podcast. I am Courtney Pesic, and I am your podcast host. Today, we are speaking with Dona Murphey, and we will be discussing brain health and cognitive awareness during the middle stages of life. Dr. Dona Murphey is a Korean-American neurologist, neuroscientist, and community health worker in Houston, Texas, and Seattle, Washington, with over 10,000 hours of community organizing experience at the intersections of race, immigration, poverty, and health. She serves on the Area Planning Advisory Council of the Area Agency on Aging and also brings experience in providing diagnostic services in clinical trials and drug development for brain disorders to her work in family caregiving support for dementia. Her social impact company, Prognosis.com, is motivated by her extensive family history of dementia and caregivers navigating many social, structural, cultural, and interpersonal barriers to counsel, care, and community with disease. So thank you so much for being here today. I'm extremely looking forward to this conversation we're going to have today.
Yes, I am as well. Thank you so much for having me.
Yeah, absolutely. What brought you into your area of expertise?
Oh gosh, I think it's a combination of many things. I've been a support caregiver for the last decade to my maternal grandfather, then my maternal grandmother, who is still with us, my father-in-law, who's still with us, my adoptive father, who's still with us, my father, who has actually mild cognitive impairment. All of the others had or have dementia. Mild cognitive impairment being a precursor for dementia that ordinarily over time will progress, but doesn't always. And there are things that we can discuss today that will help us to delay that progression.
So with your area of expertise, did you get into studying neurology prior to caregiving? Did it kind of fall into
did.
place? Yeah.
Yes, I kind of did. So actually, my very first experience with dementia was when I was a child, and that was with my paternal grandmother. And she was part of the reason that I became very interested in the brain. She and also somebody who's very close to me in our family who has epilepsy, who had a childhood epilepsy, were kind of my inspiration for going into neurology and neuroscience. And then, as it turns out, as I got older, I had this very intimate experience as becoming a support caregiver for these many people navigating this very difficult disease and understanding more, I think, about not just the person who's living with the condition, but the person who actually is choosing to be their primary caregiver. Those people in our family have been almost exclusively women. There's one example where it's been a man who's been the primary caregiver. That as a woman too, like that really, I think. Concerns me that women are struggling with this, are in some cases dropping out of the workforce in order to do this labor that is often uncompensated. I do a lot of community organizing and advocacy, as you mentioned. I actually got a community health worker certification, kind of thinking also the importance of this like ground up education and support that we can provide in our communities where health systems don't necessarily meet our needs. And I think increasingly now, with some of the changes federally in publicly funded healthcare, this is true. From that lens, also, I have felt that we are really under leveraging the lived expertise that we have. And so, it's all kind of come together for me, like my professional training in neuroscience and neurology, and then also my personal experience and my passion for community-oriented change.
Yeah, that's I guess I would say it was a gift that it all for all those on the other side of this, including your family though, but that it all wrapped up together, that your passion really led into caregiving for not only your family, but exponentially, right? And for us that are listening into this, that can help others, but what a beautiful road that you've taken. And thank you for doing that. Thank you for being the word and the voice of this. And so what were some of the early stages that you see or that we should be paying attention to? And do you believe that any of them are reversible?
Yeah, so some of the early signs and symptoms that I think we should be aware of, trying not to use like kind of jargon, but words that most people understand, right, are
Mm-hmm.
changes in memory. And those changes in memory can be reflected in like difficulty with finding the right words. Um, it's generally short-term memory that we see people struggling with. And so, that would be like walking into the kitchen um, with the intention of grabbing a cup of coffee and then not remembering that that's why you had walked into the kitchen. Um, and then, you walk out of the kitchen and you remember, right, that that's actually why you had intended to go into the kitchen in the
Mm-hmm.
first place. That's, not as concerning. But, when you start to do that, where you walk into the kitchen, you forget, and then you get distracted with like washing the dishes and you never come back to that thing that motivated you to be there in the first place. We start being a little bit more concerned when you're just kind of forgetting altogether, right? So it's now having functional consequences for you, these kinds of memory changes. The other three things that I often talk to people about are changes in speech, thinking, or behavior. So all of these things are part of our cognition. And some people think that dementia is just about memory. And I will say that is a very kind of classic and prominent feature of the most common kind of dementia, which is Alzheimer's dementia. And these are all age-related diseases, the ones that I'm typically dealing with, which are Alzheimer's, vascular dementia, um, also Lewy body dementia, frontotemporal dementia. Those are the four like most common kinds of dementia that are age-related. Um, Alzheimer's is the one that really is classically about memory, but some of those others really show different kinds of symptoms in those other categories of symptoms and signs that I mentioned. And the difference also between symptoms and signs, for people who aren't in medicine, is that symptoms are things that we experience ourselves in our bodies, right? That we observe about our own behaviors and we notice that something has changed. Um, Signs are things that others actually observe about us. So we may not be conscious of those things at all, but they are not our normal behavior.
That's signs. That's great that you define that as what others. Um, how do we, when we start to hear that, how do we digest that, right? When you've got a significant other or somebody in your life that says, I'm seeing signs of this, and maybe that person isn't aware of that, and maybe they do. Do you find that people take that maybe offensively, or they don't know how to react because they're not seeing it within themselves, right? As you said, they're from others that other people are observing. And as you were talking, I've being in menopause, I'm feeling that there's times that I do go to the kitchen, right? And I'm not sure that I remember that I was going in to get coffee. And then it's like, oh, yes, like you said, dishes. Oh, let me finish that up. And then remembering there. And I do feel that brain fog, or I do feel the lack of being tired, right? But how do we ingest or digest when you're hearing the signs from others?
Yeah, this is a great question. And I think I have to often remind myself because I'm always or often thinking about dementia in terms of how it impacts the caregiver. But obviously, the person who starts off experiencing the disease and being conscious of that is likely the person themselves, right? So what happens in dementia is that at the very beginning, we we really do believe that people are aware of what's happening, and maybe as a function of stigma, um, or other reasons, they have decided not to disclose that to others. If somebody should bring up their observations of how they may have changed, they may deny it. But we do think that early in the illness, people have a consciousness of it. Regardless, the outcome may be that they don't admit to that, right? And so just being sensitive to like why they might not want to admit to that. I mean, there are no really robust systems in place to help us age gracefully when we have this disease. I mean, in general, to age
Right.
gracefully, but when we have this disease, even more so, and it becomes a huge cost in so many dimensions, right? Emotionally, socially, financially, physically. to the person with the disease themselves and to the person who becomes responsible for their care as time goes on, because that is the nature of dementia, is that it is neurodegenerative. It is a worsening of these symptoms over time. And so, yeah, I think we have to be mindful that people might be ashamed. And so to kind of accuse them of things or to insist that, they're being delusional or something, this is not helpful. Kind of making yourself available, so not necessarily naming that, oh, you have this problem, right? Just admit that you have this problem, but saying, hey, look, I'm more available these days. If you need a ride ever, or if you need X, Y, or Z, the things where you're seeing that they're maybe having a little bit more of a struggle as they get older, making yourself available, trying to organize people around you, maybe other family members, people in the neighborhood, people who are part of their social communities, maybe they're part of a faith-based community, something like that. And just encouraging them to just kind of reach out, like it's really no problem. Feel free to reach out, but also maybe even if they don't reach out, making yourself available to help them where you're seeing some of these challenges, right? And then just keep an eye on it, because, maybe it doesn't get worse and maybe it does. And if it does, then there are lots of other things that you need to start talking to them about potentially, and to especially the care team about, as that starts to come together. When you mentioned menopause, it's really interesting to me because, most of us who do caregiving work in dementia are actually in this kind of sandwich generation, about 50% of us. About, I think, a third are people who are over the age of 65. So they're, usually spousal caregivers. Those of us who are in our middle age are usually child caregivers. And then there are, unfortunately, very young people who end up being caregivers as well. And they're often children as well, but they might be grandchildren to, others. And for those of us who are middle-aged, who are overwhelmingly women, as I mentioned before, about 2/3 of the people who do this caregiving work in dementia are women. We are dealing with, at the same time that we're dealing with this person who may be having cognitive changes because of their dementia, we are dealing with some of what you're talking about in terms of like perimenopausal symptoms or menopause, right? And that also involves some changes that sometimes worry us for dementia, right? And a lot of us are biologically related, right? Like to the people that we're caring for. And so there is that little bit of risk, like heritable risk. But there are also risks that are associated with behaviors that we often share with our family members too, right? How and what we eat, whether we exercise, how we exercise, right? Like those behaviors are often similar between family members as well. And so we have these risks for dementia ourselves. And so I think a lot of us are really worried about that. And I remember very specifically, there was one of our caregivers who ultimately said, I think that this is actually menopause. Like, I don't know that that I'm having dementia in my 40s, like I think that I'm having some menopausal symptoms. And I was like, that's very possible, right? So we need to be cautious about, ascribing this to really something that doesn't have a cure, is not transient in the way that menopause is. Now, menopause and perimenopause happens over quite a period of time, but it's not like dementia that actually gets worse definitively over time, right? It is a transient epoch of our lives. And so, yeah, it's different. So I think it's important to be conscious of that difference. It helps us to probably get through it and not get freaked out about some of those changes that are often present in perimenopause, menopause. Yeah.
Yeah, and as you bring that up, like lifestyle is often brought into this. And so what are some of the actions and the biggest impact that we can have on lifestyle choices, or actions that, help preserve our cognitive functions?
Oh, absolutely. And there are a lot of things where we're looking at the changes that happen in menopause and in dementia, where we think there is involvement of like pathology or things that shouldn't be happening in our vasculature, um, or our blood vessels, right? The health of our blood vessels. And the health of our blood vessels is largely related to some of the choices that we make in our lives, right? The things that put us at greater risk of all of the cardiometabolic diseases, right? Or dysfunction, like high blood pressure, diabetes, obesity, high cholesterol, right? Not exercising, or physical inactivity, smoking. Also, obviously, that can lead to blood blood vessel damage. Um, Air pollution, actually, which is what, interestingly, this is one of the 14 modifiable
Mm,
risk factors. Everything else that I've just named is also on that list. These are the modifiable risk factors of dementia. Air pollution can also accelerate dementia or precipitate dementia. That's the one thing on the list of 14 that we can't change on our own. Obviously, that's not just our singular choices as individuals, but that's
sure.
something that we have to kind of advocate together to
Mm-hmm.
change in society. Um, but yeah, so a lot of these things, I think, if we're mindful of those choices that we make, largely having to do with diet and exercise. Also, sleep is super important. Sleep is actually not on that list of risk factors, but we know that it very much impacts our cognition, both in menopause and in dementia. Um, these are things that we can control as individuals. Sometimes it's harder for some of us than others, and sometimes there are actually systemic or structural factors for why it is harder for some of us than others. But we ultimately do control those things. And I think it's important to address what we can address. And it can substantially, I think, change how much it impacts, right, our ability to function cognitively, which includes, as I said before, behavior, right? It's not just
Right.
like being able to think through or like problem solve, right? It is also our behavior, our experience of our lives. So yeah, the quality of life, right?
Yeah. Yeah. And as you say that, again, I'm going to rope this in too, is like, how does stress and sleep work in that? And how are some of the behaviors, how can we include some of those behaviors starting earlier to
Yeah.
really help along the way, right? And how do those, within those behaviors, how does that make the brain and that a little bit better
Yep.
if we're starting
Yeah.
earlier?
So interestingly, let's talk about brain fog, which is a
Yeah.
common cognitive kind of symptom that people observe, right, of themselves when they're going through menopause. Also, we see it in long COVID, for instance. What we've seen is that there are things that we can do in terms of diet, exercise, sleep that really can impact this. Um, Diet, I think, is a really interesting one. We talk a lot about the mind diet, which is a brain healthy diet that is kind of derived from the Mediterranean diet. Things that we know about heart healthy choices that we can make, dietary choices that we can make that also has similarly protective benefit in the brain. That mind diet is largely, trying to emphasize dark leafy greens. It also talks about antioxidant foods like berries, right? Nuts, um, these things, lean proteins, fish, right? Like these are the things that we want to kind of optimize. The interesting conversation in our communities of caregivers for people living with dementia, right, where we're also dealing with like, what are those things that we do have control over in terms of delaying the progression of this disease, or in some cases as caregivers ourselves, right, who do have that increased risk, heritable or behavioral risk. And maybe in this moment, it's actually just menopausal symptoms that we're experiencing.
Mm-hmm.
We do also still have a long term that increased risk. What can we do now, right? Or yesterday, what can we do to prevent onset, even, right? And those 14 modifiable risk factors prevent, like, if you address those robustly, aggressively, it prevents or delays the progression of 40% of all disease, of all dementia. So it's really substantial, the effect. And what we found in our communities, which we try to focus on the people who are disproportionately impacted. So often that tends to be people who are lower income and from communities of color. It's that the advice that's given, and when we're just talking about that mind diet, right, which is a Mediterranean diet. It's not really adapted to the actual foods that we eat. Um, so while I can say like these are the things we should eat, it's more powerful to say, like, within my heritage foods, what are those dark leafy greens that we actually eat, right? I mean, like, those would be in Korean food, perilla leaves, which many people do not eat, right? In
Right.
maybe Southern food, right? Like it could be collard greens, right? For some, it might be spinach. So it's different. And for people to give you a little bit more direction, I think that is more tailored, is helpful, because otherwise you're like, oh, yes, of course, I know I should eat a Mediterranean diet. And who eats a Mediterranean diet apart from people who live in the Mediterranean?
Right.
or
Right.
or those of us who have decided we're going to have to just totally transform what we eat ordinarily because we want to be attentive to our brain health. And I'm like, that's not fair. Like, we should be able to make adaptations to what we do eat to maximize our ability to protect our brains.
Yeah. And how does sleep play into that? How does, I mean, with diet, and I mean, I know that I've adjusted diets throughout the years and things like that. And even with age, I see with maybe night sweats and things like that, sleep is different. So I can imagine as you age and, as we hear, sleeping is less, maybe the older you get, or you hear that you're up at 5 a.m., all the time. You're not getting that full sleep, or maybe they just sleep a couple hours that age. Like, how is that? How do we start to be sure that we're getting the right amount of sleep to be sure that our brain's working correctly?
Yeah, I think there is a range. I think increasingly studies are showing us that you need somewhere between 7 to 8 hours.
Hmm.
Um, kind of across the board, which I really grapple with because for me, it doesn't feel good to most of the time to sleep that much. Actually, I'm
Hmm.
accustomed to sleeping 5 to 6 hours,
Hmm.
but it really does look like in terms of the population, it is best to really aim for that amount of sleep. And that is hard. Like, as neurologists, we're often having to counsel people on sleep, what we call sleep hygiene, right? If you don't sleep enough, you'll get more migraines. You'll be at higher risk for neurodegenerative disease. You're going to have more problems navigating the brain fog and the cognitive symptoms of menopause, all of the things. So sleeping sufficiently and good quality sleep is super important. Another thing that people don't understand, they will actually drink alcohol in order to quote sleep better, is that it
Hmm.
actually is really fragmenting for our sleep. It's really
Sure.
bad for the quality of our sleep. Even if we perceive that, it zonks us, like it knocks us out,
Right.
the actual health benefit is not there. And so we shouldn't be doing that for our sleep. There are lots of things, again, behavioral choices that we have control over in terms of sleep hygiene that we can do to make sure that we are getting enough sleep and getting good quality sleep. Some of that is making sure that you have exercise incorporated into your day and sufficiently apart from when you're actually going to try to go to sleep so that you're not all energized right before you're trying to go to bed, right?
Hmm.
And we're usually aiming for like an hour of exercise a day if possible. And that's moderate exercise, is what we aim for. We also want to make sure that we have a routine if possible. And that involves, I think, something that is really common these days, like kind of putting your electronics away, at least
Right.
like an hour before bed. And making sure that whenever you are in your bed, that it is for purposes of sleeping or, intimate activities, but really
Hmm.
for nothing else. You should not be lying in your bed to read a book for a couple hours. You should not be in your bed otherwise because your brain associates that place with the activity that happens in that place. And so it's good to have, your brain associating the bed with sleeping. Um, yeah, so there's some of these things. Also, not drinking a lot before bed or caffeine after a certain hour in the day, like too late in the day, right?
Hmm.
Those things help as well to get good quality sleep. So yeah, very, very important. Sleep is so vital, and I'm sure anybody who's listening to this who actually knows me is like, oh my God, Donna is like so hypocritical. I know all the things to say. I'm a neurologist, right?
Right,
Like I
right, right,
know what.
right. Right. Absolutely. I get it. I get it. Yeah. So, in the context of menopause or like midlife transitions, what does brain health strategy should we emphasize, or what would counteract the cognitive brain fog that so many of us women really experience?
Yeah, it's super interesting because I think lately we've realized collectively how important it is to study this. And so we see a lot more evidence coming out lately about things that, we were advising actually like quite the opposite in the past, right? On like how to deal with menopause and some of these symptoms that we have in perimenopause as well. And, it does look like, for instance, there is like moderately strong evidence that if you go through early menopause for whatever reason,
Hmm.
that you do have significantly increased risk of dementia. So I think it's exceptionally important in those circumstances that when you go through that, you should immediately be counseled about those risks. And if it's a choice that you're making, right, like a surgical choice, for instance, where you're going to be going through early menopause, you should be aware of that. You should be counseled on that, and you should be told what are those 14 modifiable risk factors of dementia that today, right, at 35 or whenever it is that you're choosing that, if it is a choice, you need to start focusing on to really preserve your brain function for the longest time possible, right, in the way that you're accustomed. I think that's super important. The other thing that has been interesting is that there, does seem to be some increasing evidence that, like, I mean, there's also a long body of evidence of this, but it's been
Sure.
kind of equivocal for many reasons. That actually hormone replacement therapy can be helpful for some of these symptoms as well, not just the cognitive symptoms.
Mhm.
So, in terms of quality of life, like that is really important. So continue to investigate, to talk to your doctor about if that makes sense for you, right? Whatever other risks, because with any kind of therapy, there are always risks or side effects, right? Within the context of your own health, does that actually make sense in terms of risks and benefits? It is something though that should be considered, right? That you should have a conversation with your doctor about, because it can help to mitigate some of those symptoms that you may have during the process of perimenopause, menopause, and then yeah, I think those are probably the biggest things that I can think of in terms of how you can really think about your brain health as it pertains to some of the changes that we undergo as women. Yeah.
Yeah, and do you believe that we're doing enough to educate people? I mean, I know that right now, I think we're having this upswing of talking about menopause, but finally, right? Like it feels like it's been such this taboo subject, and now I believe that it's a bit more coming in the spotlight, as much as we'd like to have it out there and discussions more about it, but we're understanding that maybe we don't understand everything about it. And it also feels like everything's kind of changing. The more awareness we bring to it, the more we're finding out different studies, different information, maybe things that were
Right.
wrong in the past that are now becoming more prevalent now. And I think studies, uh, which you've been in, are highlighting many different things that we can do that maybe we thought we couldn't, or, different ways of doing life. What do we see, and are we doing enough to educate people for both of this, for dementia and for menopause and the connectors and leading towards that?
Yeah, no, I think that we could do so much more. I'm really pleased with the work that you all do, that Positive Health does, in terms of bringing visibility to this period of transition for women, giving us, I think, tools, information, also community, I think is important. The community is actually really key to the
Yeah.
work that we do, because dementia is also a process. It's often a much longer process, sometimes lasting 10, 20 years, that you're dealing with that, as the person living with it, as well as the person who's caring for them. But, going through this transition for women is also a process. And to have other people who can talk to you frankly about that. And like I said, I'm sure just as in dementia, where there are aspects of this that really beg for cultural fluency, right?
Mhm.
Not just to anybody, not just to any woman, but like women who like kind of share life experience and identity, and because the way that we talk about things, so some of our beliefs around some of what's happening to us, I think, are shaped by culture. And
Sure.
so it's nice also, I think, to have that as a part of the access to community that we have. And yeah, I agree that in the past, like we did not talk about this as much as we should. I think if you look over time, that's just generally true, that like things
Mhm.
having to do with women, and I would argue that in this
Mhm.
moment, there's even kind of a stepping backwards with some of this,
Sure.
right, in terms of
Sure.
women's health. It's But in general, I think that we've kind of become more expansive and inclusive, in thinking about what is specific to our health, what happens to our bodies over time. And we should be able to talk about that just as we talk about any other health condition or health
Right.
journey, Yeah.
So, if you were to leave our listeners with three things that you would want them to put in their pocket from our conversation today, what would you leave them with?
Prevention, prevention, prevention.
Sure.
um, yeah, I mean, I have no doubt that like even some of the cognitive symptoms that we see in menopause, it may be the case that there's no way to completely erase them, right? But there are things that we can do to mitigate the impact on our lives of those symptoms. Education, I think, is really crucial for us to understand. Like I said, some of the time when women are going through um, the, these transitions earlier than they might have otherwise, to really understand what that means for their long-term cognitive health. That we should be advocating for at a really big level, like so that it's never the case that somebody doesn't understand those risks. Um, and I think people are doing it in medicine now. That like if somebody's undergoing like a surgical oophorectomy, right, like removal of the ovaries or something, that
Hmm.
they are counseled on these things. Um, I think beyond that, it is like really finding your people in terms of a community of support, right? Like where you have these shared values, you have a shared understanding of like what's important for your health. I mean, really, it's holistic health. It's not just brain health. The things that we
Sure.
do for our brain health also have impacts on our heart health and
Absolutely.
yeah, and
Absolutely.
our overall well-being, right? So
Sure.
like but sometimes we need each other to hold ourselves accountable because it's hard. Like the
Hmm.
choices that we make every day, we're I think distracted. Like we're distracted by a lot of options that are not necessarily healthy options for us.
Hmm.
Sometimes we're just kind of exhausted and not wanting to. We don't have the willpower, I guess, to make the right choices for ourselves. And so it helps. I think it helps to have other people around you who are kind of doing the same thing and you like share that commitment. Um, yeah, I mean, I think those are the biggest things. Yeah.
Yeah, that's so huge. I mean, in life, period, like you're saying, like just an accountability partner to take a walk, to,
Yes.
even a diet. Have you had your nuts? Your community to let the words out that maybe you're struggling, or somebody else who's also caregiving, understands what it feels like to be the caregiver at this age or within the community or that. And really having others to lean on during all this time. I think even
Right. Right.
throughout dementia or being within that, just having others around that can be so big for
Yeah.
everything. So big
Absolutely.
for
The,
everything.
the the last thing I wanted to say, actually, I forgot to mention,
Hmm.
is that
Hmm.
um, for the women who are middle aged and caregiving, right, who are maybe going through multiple kinds of journeys at the same time,
Hmm.
um, I think it's important to understand again. I said this before that what you're experiencing in terms of cognitive symptoms are not necessarily at all dementia, right? Like
Hmm.
it's typically the case that if you are going to develop dementia, you're going to be preclinical at this stage in your 40s, in your 50s. You're not really going to show overt symptoms or signs of the disease necessarily. So this is probably not something of concern. So you don't need to, I think, be overly concerned about it in a way that's really negatively impacting your well-being. But you should keep an eye on it, right? You should keep an eye on it, and it should be motivation to make those right choices now. Um, I hesitate to be too aggressive about saying like, oh, this is likely, an indication that you may develop dementia, because there are such profound, I think, psychological consequences of hearing that.
Hmm.
Um, and so yeah, I want to just be cautious about that and just remind people like there are a lot of overlapping symptoms. There is a relationship. It's not a causal relationship. We do see that there is a relationship between reporting of perimenopausal or menopausal symptoms and cognitive behavioral symptoms as well. Okay, but there's no causality that we know of.
Hmm.
So we just need to know, like, sometimes you have symptoms that could explain multiple different things going on. It doesn't mean that that's the path that are destined for. And there is no
Sure.
destiny with dementia. Like there are so many things we can do to prevent it, like I said.
Thank you so much for having this conversation with us. I think this really sheds a great light just on all different aspects of it, of all different aspects of life and where we can be and what we can do to really help ourselves and others with the conversation and educate ourselves looking forward.
Yes, thank you so much.
Yeah, thank you. So please listen in as we release new Menopause the Positive Way episodes the first Wednesday of every month. And until next time, here's to your continued health. We are so glad you joined us for this episode of Menopause the Positive Way, and hope you will share this podcast with friends and family. You can subscribe to the series wherever you get your podcasts. Along with this podcast, Positive Health also offers a holistic, one-stop digital health experience supporting your body, mind, and spirit during the menopause journey. If you or anyone you know is looking for guidance, education, and services that address the many symptoms and needs experienced during your menopause journey, you can become a member of our pilot program. And you can join by visiting our positivehealth.com website. That's PAUSITIVE health.com, making life easier and helping you make a change for the better.
This is an educational podcast where the views of our guests do not necessarily reflect the views of Positive Health. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Positive Health does not provide medical advice.